One of the most difficult aspects of medical school, aside from all the time that you have to put into it, is of course the stress that can be associated with the financial burden of it.
I was kind of on the line about, if I do primary care, will I be able to pay back my loans?
It's a reality of being a medical student and going into this field of having to think about how you're going to provide for yourself and your family. And this allows me the freedom to focus back on those patients that I really want to without having to balance that practicality aspect.
When I found out that they had the scholarship for primary care physicians, and that one aspect of that scholarship is that after you graduate, you get to go into the community and really serve the areas that need it most, I thought that was just a perfect fit.
I've seen firsthand and with my own family how healthcare can really shape in a positive and a negative way.
The primary care scholarship is already aligned with my core values that I wanted for my life in medicine, into weaving a common thread of caring for underserved groups.
When the scholarship came out, it was basically the university saying, hey, we recognize people like you who are from this community, who want to help this community, who want to stay a part of this community, and now we're offering you a scholarship to do it.
I feel like a lot of times for certain populations that have been historically cast aside or marginalized, the relationship that is already established with healthcare is just so broken that primary care really does have the opportunity to meet communities where they are.
Letting them know up front, I see you and I see these problems, and not making it a moral decision whether they're bad because they can't come to this appointment or they're good because they took their medication. Rather, I see the struggles you're having and I'm here as part of this team to help you with your health.
Being here, dedicating myself to being in Arizona and dedicating myself to these populations was what I needed to do, and it was kind of like a no-brainer.
What led me up to coming to this school was knowing that I wanted to stay in Arizona, where I was born and raised. I wanted to work with the communities that I grew up in, and I wanted to have my own way of forming an impact.
That's what drew me to the University of Arizona as a whole, that not only does the school provide you with a great, knowledge base and medical background, but that they're really committed to serving the community and interacting with people in the community and giving back.